righty, well, I wanted to welcome everyone to this humid afternoon running on generator power to June's Board of Health meeting. We currently do not have a quorum, but we are gonna press forward into the items that don't require board approval. But before we get kicked off, I would like to start us off with an invocation. Please bow your heads. Dear Heavenly Father, we thank you for this rainy summer we've had. We thank you for this beautiful weather and us being able to get together in this room to discuss the matters of the county and the Board of Health as we gather here tonight. Thank you so much for your grace and your guidance, and we trust that you're with us. In the Lord's name we pray. Amen.
You want to switch over to the slideshow?
So the next item on the agenda, we're going to have a swearing-in ceremony for our newest Board of Health member, Miss Ruth Miller.
Thank you. Okay.
Welcome.
Thank you. It was always bad. Wow. Thank you.
Thank you.
Now I got something to show to Scotia Village.
So now, we can't approve the agenda, right?
For quorums 4, or is it 5?
We can welcome the new administrative assistant.
Because I think there's 6.
Then we'll jump down to departmental updates.
Yeah.
3, 4, 5. Okay, 4. 6 members. Yep.
So next week, I'd like to welcome my new administrative assistant and clerk to the Board of Health, Ms. Kiana Jones. She's replacing Christine Russell. Kiana has been with us how many years? 2 years in WIC, so this was a promotion from being a processing assistant in WIC up to administrative assistant. And I'm glad to have Kiana as my assistant.
Welcome.
Welcome, Kiana.
Welcome.
I wish there was more of us for you to meet this afternoon. You take us in bits and pieces. Alrighty, well, without a quorum, we're going to move directly into departmental updates. So we're going to go ahead and go Erica Hall.
Hello.
Good evening.
My name's Erica Hall. I'm lab manager at Scotland County Health Department. I'm going to give you a little overview of the lab and some of our duties. First of all, we're a CLIA certified lab, and CLIA stands for Clinical Laboratory Improvement Amendments. The objective of CLIA is to ensure quality laboratory testing. CLIA certification indicates our lab has been inspected and has met all the requirements to be certified to perform lab testing. CLIA inspections are every
How often do you get in? Oh, you were getting ready
okay.
to say it right
Okay.
there.
CLIA inspections are every 2 years.
Okay.
We just informed last week that we actually have an inspection tomorrow. So,
Okay.
we
Is
didn't have
that so? They're not announced. They're not scheduled. I guess so. You
they
get a.
let us know last week that
Okay.
we have one tomorrow. And we have one last in December of 23. We didn't have any deficiencies. We're not expecting any deficiencies this time. We're rolling on and doing well, hopefully. Everything's good. Our lab performs in-house testing, and we send specimens out to reference labs. Specimens we receive in-house are from the STD, family planning, maternal health, adult health, infectious disease, labs to go, and DSS clients. Our in-house testing consists of pregnancy, glucose, 1-hour glucose tolerances, hemoglobins, urinalysis, wet mounts, burn slides, urine microscopy, gram stains of urethral smears, and gonorrhea testing is what we actually do in-house. And we perform urine drug screen testings for DSS, and then we collect buccal swabs for paternity testing for DSS and LabCorp that's sent out. We just do the collection. We don't do any testing on that. We send the majority of our send-out specimens to the North Carolina State Lab and LabCorp. We send our gonorrhea specimens occasionally to Scott Memorial Hospital when we're closed for holidays, and that's because when we collect, they have to be reported within 72 hours, so we don't send those. We don't do those in-house at that point. The lab staff are required by CLIA to enroll and participate in proficiency testing events. These occur 3 times a year. We also participate in additional proficiency testing as a referee lab for the North Carolina State Lab of Public Health. And there's only a few labs that do that. We're one of those. Throughout the year, I review and update policies and procedures as needed, review laboratory test forms for updates and changes, review quality control records monthly, quality assurance is performed and documented throughout the year. And that's just a few things that we do in the lab. I just said a minute ago about the labs to go, just to let y'all know a little bit more about that. For those of you who don't know, Labs to Go is a service that allows any person to be able to come and request labs from the Scotland County Health Department, standing order, or submit a provider order for labs. We started offering labs to go in September of 17, and at that time we had about 40 labs for the providers to choose from. We currently have a little over 120 labs for providers to choose from, and a little over 20 labs to choose from on the standing order, which doesn't require a provider's order. The prices for lab tests or labs to go, they're really reasonable. So if you ever need them, y'all come check us out. A few examples of the pricing for some of our most requested labs, like a CBC is $9, a CMP is $9. A lot of people need checking for diabetes, A1C, it's $10. Along with the cost of the test, there's a single venipuncture fee of $11. It's added to that, and it doesn't matter if you get 1 or 50 labs. It's that one venipuncture fee. If you get a urine test, it's $11 because that's a handling charge. As a courtesy, county employees and the county retirees don't have to pay that venipuncture or handling fee. Lab results are typically ready in 1 to 2 days after collection. Release the information signed. Lab results can be faxed to the provider, or they can be picked up at the health department with an ID. Payment is due at the time of service for those. Cash, check, debit, credit, HSA cards. We do not file insurance for this, so money up front. No appointments necessary. You can walk in anytime between 8 and 11 o'clock and 1 to 4, Monday through Thursday. And on Friday, you can walk in from 8 to 11, We don't have Friday afternoon, because LabCorp picks up at 1 o'clock, so we can't leave specimens over the weekend, so that's why we're doing Friday afternoon testing. And so that's basically all I have. Yes,
How
ma'am.
fast does LabCorp get back to you? Because I know I have an account with LabCorp.
If
And they
they're,
get to me sometimes before Scotland Memorial does.
as far as the results,
Yeah.
if they're basic tests like the CBC,
Yeah,
CMPs, lipids,
right.
stuff like that, they're a lot of times next day if you get in before LabCorp picks up at 1 o'clock.
Okay.
2 days max usually.
Suppose someone doesn't feel good, not really sick at the time, but ends up with an elevated white count, 11, 12, 13,000, and it comes back the next day. How do y'all manage that?
Well, if they're, most of the time, they come in with a provider has asked them to have a CBC done.
Okay.
And we fax those results. If they're an abnormal result, we also call the doctor's office and let them know that it's
Okay.
elevated.
So, because things do get lost in the system.
Yes, ma'am. Any abnormals, especially alerts.
Yeah.
A slight abnormal, we wouldn't, but an alert, we always call and let the provider know.
Oh, okay. Now, your courier, who picks up?
LabCorp for the labs, labs to go. North Carolina State Lab of Public Health picks up like our syphilis, HIVs, chlamydia,
okay.
gonorrhea, stuff like that.
And 1 o'clock every day for LabCorp, or they get
It-
earlier
it's-
depending?
It's anywhere from about 1 to 2,
Okay.
but they can be as early as 1, so we say 1.
Because I'm sure they've got lots of people to
yes,
pick
ma'am.
up from. Yeah. Okay. Thank you.
So can someone just come in and ask for labs and tell you what they'd like to have drawn?
Yes, ma'am. We have, in fact, I have that here. We've got a standing order that you can request labs off of. Without a doctor's order, any of these, you can walk in and say, I want to get this stuff tested. And here's, if you want to pass it around, that's the list of provider labs that we have that the providers can request. And if a provider ever needed to add anything, they just contact me. I check with LabCorp, our representative looks into it, and we get pricing. And it usually, by the time we get the pricing from LabCorp and it gets put on, sometimes it could take almost 2 weeks, a week to 2 weeks, but if there's any additional tests that people need.
Thank you.
Thank you. Very informative.
One more question, Ms. Hall. Do you see, I feel like I need to ask in the spirit of Ed, Commissioner O'Neill not being here tonight, do you see any opportunities, any additional services that your lab could provide that would be a benefit to even county employees?
I do not at this point. We get so many labs that we could do through Labs to Go. So unless we had an increase in numbers of our clients to come in, it really wouldn't be financially really well to, you have to have, just say a CBC machine. You've got to have all of your quality controls, and they're expensive. It just wouldn't be financially smart for us to do 3 or 4 CBCs. We'd lose money.
Yeah. And then, equipment gets
Now,
outdated.
if we had 50 or 100, that's different.
That's different.
But we don't have the clientele right at this point to do that.
Understood. That's all I had. Everybody good? Thank you.
Thank you.
Moving ahead to Mr. Tim with the fiscal update.
Good evening.
I was gonna let y'all pass. Everybody look at it.
We did not get it around to Miss Miller, but I'll pass it around.
Oh, okay.
Thank you, Miss Jones.
You just got to be the runner.
So,
Okay, that's what I was going to ask. Oh, that's great.
you turned up. Okay. Can y'all hear me?
Talk louder.
Okay. Talk louder. Okay. I can do that. Good evening. This is the financial report as of May 31st, 2025. And then at the end of this presentation, we'll talk a little bit about the budget that is for FY '26. So once again, accreditation requires that you know what 10 essential public health services are when you make any financial decisions for the health department. So the next slide will be the expenditures. As of May 31st, 2025, we should be 92% expended. Currently, as a total, we are at 84.2%. So we are under budget as a whole.
Do you anticipate any surprises this last month?
No
Even though you're halfway through it at this point.
Actually, the county cut us off. The county cut off spending, like the end of May, like very first part of June. So there's really nothing much left that's been purchased in June that's going to show up. So yeah, they cut off a little early this year to try to save some monies. If you are aware, the county was short anyway, so they were trying to cut the purchasing back a few weeks to prevent that surprise happening. But I don't foresee any surprises, no, sir.
Is there anything, what if there was something that was absolutely needed?
We have the ability to, the department head, Ms. Amanda, has the ability to request something for emergency purposes through Beth, the finance officer, to get it approved. But it has to come from the department head and to be approved. Any questions on that? Okay. The next slide or the next page will be your revenue collections. Also should be at 92%. You'll see that we are at 74%. We are not under collected at time. Please note that we were down a provider for 2 months. We just have a part-time provider now, and she just started seeing patients talking about 2 weeks ago. So, but Don will talk about that in a little bit. So that's why our numbers are a little down.
I see adult health is almost 200%, if I'm reading that right.
That's correct.
Anything to note there specifics?
We had more people come in or getting school and work physicals than what I had budgeted for originally the previous
Almost twice
year.
that's a good problem,
Yes,
right?
yes, sir, absolutely. So what I budgeted for is what we have done in previous years, but fortunately for us, we had multiple people come in and rent those services for school and work physicals, and those are upfront cash services. There's no insurance. They bring a note from their doctor or their college saying what they need, and we perform, and they pay up front for those services. So,
Thank you.
and I will let you notice on the SimHarp and the CMARC that also they have we've received more money than what I had budgeted for due to the fact that the social workers, Ms. Betsy's here, doing such a wonderful job for these Medicaid companies. They reimburse them for the clients that they see, and so they're going above and beyond seeing those, so that's why the revenues are more than what they were budgeted for. So,
Thank you.
any other questions on that?
No, sir.
Yes, ma'am.
Can you give me an idea of the reason for the uptick in people? Are they more aware of what y'all have, or is someone sending them to you?
Their system is referral based.
Oh, okay.
So Miss Betsy can talk more about that system
Okay.
if you need more explanation on that, Miss Betsy. She's wanting to know why the uptick. Okay. It's just based on referral
Okay.
to us from the Medicaid companies or for the
Oh,
Medicaid.
okay.
Yes, ma'am.
Okay.
If there's someone who's needs pregnancy counseling or pregnancy services, or children 0 through 5 who go to the emergency room, instead of finding a primary care provider, they encourage them to find a primary care provider instead of going to the emergency room, and then they follow them all throughout that whole process.
Oh, that's great.
Yes, ma'am.
Thank you.
that attributed to any kind of marketing campaign or it being better known, maybe a provider sticking around longer and knowing more about our local services? Is that?
You want me to answer? I know a little bit about this program because that's what I did before I was a health director. The managed care with Medicaid pays the OB/GYNs an incentive to do an initial risk screen and then to do a follow-up screen later in the pregnancy. So that encourages them to do that risk screen, and then they refer it over to us for care.
Any other questions? Sir? Okay. The next slide is your P&L, which talks about how much the money the county puts in each program. The only one I'll draw your attention to will be TB, and the reason why that number is off is because we have not had a TB nurse in 6 months. So Miss Donna Page has been taking up that burden. I shouldn't say burden, has taken on those job duties. Feels like a burden, I'm sure. So therefore, that's cost of, there's no one's salary coming out of that line at this time. So. Any questions on that?
No, sir.
Okay. So the next thing I want to talk to you about just briefly is I have to present the budget for you for FY26 for the health department. That is the extra page extra packet you have on your in front of you. So the very first slide is going to show you. It says FY26 budget summary. This is a little bit of a summary of kind of all what we did and what we asked for and a little bit of information for you. Revenues, we do have one grant that's rolling over, public health infrastructure, for about $209,000 that's rolling over to next year. The other ones, I'm not quite sure if they're at this point in time, are they going to roll over. The ARPA funds, I believe, is one of those that's expiring. We've not heard anything back on if those are rolling over or not. And please note that the COVID funding is no longer existent. That is not rolled over. So that was about $96,000 that we were unable to request from the state because the restrictions they put on how you could spend it and the things on how you could get reimbursed for it. So I think we've discussed many times how to get rid of that money, and we could never figure out, in our small county for certain things how to get certain things done. So.
And with the federal suspension, it was suspended 3 months earlier than expected.
The expenditures, this is what we requested in the budget. We requested to fund a part-time HIV case manager. As you can see to the side, that was not funded in the budget. We requested to replace 2 animal control vehicles. Neither one of those were funded either. So those are not in the budget.
And these 3 items were requested, and they have not been progressed through the process for approval for. These are conversations that have happened this past month.
Yes.
Okay.
So you're saying, to be clear, they have not been approved for 2026 either?
The commissioners have met, and they have taken them off the budget already.
Okay, so
Yes,
they have
ma'am.
decided that this will not be budgeted.
Correct.
For this year.
I just wanted you guys to see what we requested and see what we were denied, so you will know that we were requesting certain things, and then they came back and cut those things out of our budget. So
Do you recall how many years in a row we've requested those animal control vehicles?
this is the second year in a row.